Good afternoon or good evening, everyone. My name is Jack Miller. I'm the president of Pacific College of Health and Science. Welcome to the fifth of our series of master classes. And our speaker today certainly fits that bill. A couple housekeeping items before I begin. I'd like to mention that all of these classes are for educational purposes only and shouldn't be construed as medical advice. Obviously, for any medical advice, you should contact your physician, primary care provider. We ask that you don't promote any sales in the chat box, okay? No particular brands of essential oils or whatever. This is classes for educational purposes and not meant to be for sales promotion. In that same chat box, you can put questions, and our speaker will stop periodically to answer those at certain points in his presentation, okay? Peter Holmes is an internationally renowned English-trained medical herbalist, essential oil therapist, and practitioner of Chinese medicine. He has over 35 years of experience using herbal and essential oil medicines in clinical practice, and you'll be able to meet him personally this October, God willing, if we get out of quarantine at Pacific Symposium. His extensive training includes studies with Oriental medicine greats, our friend Ted Kapchuk and the late great Giovanni Mascioscia, as well as medical herbalist and pharmacist Henri Verdier in Paris, France, medical herbalist Christopher Headley in London, England, and Chinese medicine sinologist Elizabeth Roche-Vallee, also in Paris, France. Peter's pioneered the clinical use of essential oils with acupuncture and bodywork since 1982. He's the author of several acclaimed textbooks on herbal and essential oil medicine, Aromatica Volumes 1 and 2, Clinical Aromatherapy, The Energetics of Western Herbs, Volumes 1 and 2, Jade Remedies 1 and 2, and the TCM Materia Medical Clinical Reference and Study Guide. Peter's well known for both the high quality of his snow lotus essential oils, which are used by practitioners throughout the world, and obviously for his breadth and depth of experience on the subject. For more information, you can check out Peter's website at snowlotus.org. I'm going to turn off my video and audio and welcome Peter Holmes.
Thank you, Jack. Thank you. So welcome, everybody. I'm really happy to be here. Thank you for taking time out of your hopefully still busy lives. So today I want to talk about some basic ways to empower immunity with essential oils in the context of Chinese medicine. So essentially, this topic will be two basic ways of boosting immunity. So right from the very beginning, I feel it's important to not confuse stimulating immune functions with boosting more long-term immune strength or immune potential. Those are two distinct things, and the herbs and the oils that we use to either stimulate immune functions immediately or boost immunity as a whole are quite different, okay? So let's look first of all at how to stimulate immediate immune response. This is obviously a very, very pertinent topic now, right now in the middle of this worldwide pandemic. So the question is, once again, how do we stimulate immune functions right away? Now, we know that there are many powerful antimicrobial essential oils. Probably the most widely known one is oregano, but guess what? We're actually not going to be talking about oregano. The really, some of the strongest essential oils for treating microbes, for treating infections in general, especially acute infections, happen also to be highly irritant to the skin and mucosa. So these are the ones that we're not going to be talking about today. I'll get back to them in a moment as well. So essentially what we're seeking in stimulating immune functions, especially with respect to the lung qi and the wei qi, the protective qi, are essential oils that we call fresh pungent. Okay, so this is obviously a sensory description. They happen to contain high levels of chemical components like monoterpenes and 1,8 cineol. But the key thing in terms of Chinese medicine is that they are fresh pungent and they have an affinity or tropism for the lungs and the body's exterior. Okay, the wei qi, the defensive qi. So they have this rising energy that always goes up to the lungs and the defensive qi. So they're highly protective, highly invigorating. In fact, they are qi tonics, basically. They're powerful qi tonics that target respiratory functions. What are they? Let's name them. Cajeput. So I have five top ones that I use routinely, and so they are Cajeput, Nayuli, Ravinsara, Saro, and narrow leaf eucalyptus, which is also called Eucalyptus radiata. Okay, so I'll give the Latin Latin botanical names, just to make sure there's no confusion. Okay, Cajeput is actually a type of Melaleuca, Melaleuca cajeputi. Nayuli is Cajeputa quinquinervia. It's also a type of Melaleuca and therefore related to tea tree. The next one is Ravinsara, which is a type of camphor tree from Madagascar. And then Saro, which is related, which is a distant relative of the cinnamon, actually. And then there's the narrowleaf eucalyptus, which is also called Eucalyptus radiata botanically. Okay. So what these oils do, as they target the lungs and the wei qi, the defensive or protective energy of the body, they stimulate immune functions, and we use them to treat the early stages of infections at the same time. Okay, especially respiratory infections. So these are tailor-made for early stage respiratory infections, which in Chinese medicine we call especially lung, wind, cold. Lung, wind, cold, wind and cold on the body's exterior. Okay. So, and what's so interesting about these big five essential oils that boost immunity, that stimulate immunity immediately, is that they all happen to be powerful antivirals. They're actually some of the most powerful antiviral essential oils there are. Okay. So in terms of acupuncture points, these oils, these five oils, the respiratory and immune stimulants, they work like points like large intestine 4, large intestine 10, large intestine 11. Yeah, those three mainly. Okay. So now that we know what these oils are, let's think about how we can use them. And as I'm sure many of you know, there are so many different ways of using essential oils, and that includes these powerful respiratory and immune stimulants that also happen to be powerfully antiviral. So the first method, which I've been teaching for many years, is to use them actually on acupuncture points. So in this case, we would be actually using them on the points just mentioned: Li4, Li10, Li11. You can also use them on Li7, lung 7, of course, to release the exterior, right? To release external wind and cold from the exterior. You can also put them on Li20 and B-tong, okay? And hold it there just for a second or two, and you will get immediate. So, and what happens is that the essential oil will immediately absorb into the sinus passages and open any blockage, any congestion, disinfect, relieve pain to some extent. I'm talking about these ones in particular, relieve pain to some extent, and certainly also reduce the amount of nasal mucus discharge. Okay, so that's one way to use them, is on points and including Li10, 20, and B-tong. Okay, so another simple method, which is widely used, of course, especially in aromatherapy, is inhalation in one way or another. So the simple way is just to get the bottle and inhale like this. This is, you know, I don't highly recommend it. A better way is to drop it on immediately onto a surface like a tissue, right? Drop a few drops on a tissue, inhale. For example, you can do that in your morning shower on your hot, damp, wet washcloth, right? Put a few drops on the washcloth and kind of make a teepee over your nose with the aromatic washcloth. It's also very awakening and so on. Okay. Another way is simply to put a drop or two onto in between two fingers and make a little bud, right? You see, a little bud, and just inhale. So I like this method in particular because it's very discreet. You can do that while on a bus, on a plane, you know, traveling. It's very discreet. You're not putting some drops on the palm of your hand and going like this very ostentatiously, if you know what I mean. Okay, so this is the British way of doing it. Okay, it's a very British way. Okay. Okay, and then we have another very useful way to directly absorb the immune boosting power of these essential oils is a steam inhalation, where you basically get a basin of hot water. You can do this in your bathroom, for example, or kitchen sink. You know, just fill it up with hot water, put a few drops of 3 or 4 drops of one of these oils, or a blend, possibly a blend like Viraway, onto the hot water. Cover your head with a big, thick, heavy towel, and just steam your nasal passages. So it's technically a nasal steaming, right? Where the moisture of the hot steam actually increases the penetrating power of the essential oils. It boosts absorption. You can even treat middle ear infections with this steam inhalation if it's done correctly. Okay. So that's another way. Another nifty way, which not many people seem to know about, is getting a piece of cotton, right, and making 2 little nasal plugs, which you insert into each nostril. Okay. Oh, I forgot to mention. You drop 1 or 2 drops, no more, 1 or 2 drops of your immune stimulating defensive qi stimulating oil onto the cotton ball and insert it into the nose, into each nostril. Okay, and this is one way actually of boosting the wearing of a mask. Okay, I mean, hopefully you're all wearing masks out of doors, especially in public places nowadays. So, but inserting these 2 aromatic cotton balls will definitely boost wearing a mask, the effectiveness, in other words. Okay. And of course, hand for surfaces, hand sanitizer. You can use the same oils for putting a few drops onto a hand sanitizer, you know, for topical disinfection. Okay, they're highly disinfectant, of course. Okay. What else? Foot arch liniment. So there's one last application or delivery method I want to share with you called the foot arch liniment. Now, some of you might have come across might be familiar with this treatment method through classes with me in the past. And what that is simply putting, again, 2 drops onto the arch of the foot. So, which is the arch of the foot is the area just below and proximal to spleen 4. Okay, the acupuncture point spleen 4. So it's on the arch of the foot. It's not totally medial. It's not on the sole. It's in the in-between area. Okay. You place a couple of drops. Actually, you put the 2 drops on your finger. Place your finger. Rub your wetted finger onto the arch of the foot gently. Key word, gently. You don't want to rub it away until it all evaporates, okay? Gently, and then hold it with 2 or 3 fingers. And the point of holding it is to promote some absorption into the tissues. Okay, the arch of the foot is highly vascularized, and so you do get quite a bit of internal absorption into the general circulation. In addition, we also obtain with the foot arch. This foot arch liniment treatment also creates an energetic effect, because of course the kidney and the spleen channels go right through that area as well. Okay, so it's a strong treatment. It's a powerful treatment, and you have to be sure to use oils that are not irritant to the skin when you use them. And all of the oils that I'm discussing this afternoon or evening are in fact non-irritant. Okay. So let's look at the basic. Actually, I'll take some questions at this point, Cynthia. I think this is a good time. If any of you have any questions so far.
Okay. Yeah.
Do you have any questions so far?
Yes, we do have some questions.
Okay.
Hold on, we'll get our questions for you. How do you prescribe for COVID-19 in terms of there being different phases? So we're talking about antivirals.
Right.
Yes, we do have some questions.
Okay.
Hold on, we'll get our questions for you.
So
Peter, can you hear the questions?
yes, I heard you loud and clear. Yeah. I mean, in terms of pharmacological action of the oils, the antiviral essential oils, which these happen to be, these are actually the top most antiviral oils on the planet, as far as I'm concerned. Sorry, I got distracted by something flashing. Yeah, so from the Western pharmacological prescribing point of view, they can be used at any stage of the coronavirus syndrome, disorder, whatever, infection. However, in terms of Chinese medicine, they should be used in the early stage, mainly in the early stage, or only, either mainly or only in the early stages. Okay, so in other words, up to the stage where the virus hits the throat, including whether it hits the throat, especially when it's in the sinuses and in the throat. Beyond that, and in fact, at every stage of the progress of this disease, we need to think about other essential oils as well. So this is definitely not a survey of COVID-19 treatment, okay? Because at every stage, at each of the 3 major stages, as far as I can tell, we need to add, there are other treatment intentions that need to come into play. For example, relieving damp, external damp, internal damp, phlegm, causing expectoration, reducing inflammation, reducing pain, et cetera,
Okay.
So that's a whole other discussion.
Yep. So the next question is, out of the different techniques you described, how do you decide which technique to do when?
Well, for example, at home, I highly recommend using a nebulizer like this one, which is an air pump, driven by an air pump, to keep the viral load down in the room, in the house, and so on. Okay. So in the house, regular inhalation, doing steam inhalations 2-3 times a day, just as a preventive measure, I think is excellent. Cotton earplugs are kind of drastic, and I would recommend them mainly for going out when you are actually going outside, including, as I said, when you're wearing a mask. Okay. Let's see. And obviously using them on point is done in a either home or clinical setting. Does that help?
Yeah, and somebody did ask about the masks. They said they've heard opposing comments on that, on whether it's okay to add oils directly to the mask filter,
right,
or if that's going to compromise the integrity of the mask.
Right. I've tried that, and I don't like it. I mean, instinctively, I don't think it's. I think it's okay, and we don't actually. At least I don't know whether it compromises the integrity of the mask or not. I think it depends on the quality of the mask, of the N95 mask in the first place. Okay, that's crucial because there's cheap ones and there's good ones, like everything else. But just to be safe, I recommend not putting it directly on the mask. I recommend using the twin cotton plugs, nostril plugs. That's the real way. So then you have two barriers, and honestly, if these are soaked in any of these antiviral oils, nothing's going to get through, guaranteed.
All right. The next question is, how do you differentiate between the 5 antivirals that you mentioned, the non-irritant ones? How do you decide when to use which of these? How do they differ from each other?
I think at this point of the discussion, and with the limited time we have, they're completely interchangeable. The only modifier I would add is that Saro, S-A-R-O, Saro, which is also from Madagascar, and actually happens to grow in the same dense forests as Ravinsara. Saro it seems to me to be the most gentle. So I like treating children, people who are more sensitive with Saro rather than any of these others. But honestly, you can't go wrong with any of them in general.
And somebody else asked, what do you think about ingestion of oils?
Okay, again, that's a very broad topic that we don't have time to go into here. Yeah. I mean, it is possible. Of course, it is possible. If you're practicing any kind of internal medicine and you're trained in the internal use of herbs, medications of any kind, then yes, it's possible to use essential oils internally, as long as they are true or authentic essential oils. In other words, they are what it says on the bottle, and they're not adulterated. And as you may probably guess, those are two quite difficult criteria to achieve nowadays. It's not easy.
Okay, do you want to take one more right now?
Sure.
Okay, so last question for right now is there an issue with inhaling cotton filters or mucous membrane sensitivity with the oils?
It depends what oil you use. So yeah, again, that's, answering that question would take us off tangent, unfortunately, but it all depends.
Okay, why don't we go ahead and we'll keep collecting more questions for the next time we start.
Okay, great. Okay, great. So what are these immune stimulating oils, Cajeput, Nayuli, Ravinsara, and so on? What do they specifically do? What are the specific functions? Number one, they warm and release the exterior. They warm the channels and dispel wind, damp, cold from the exterior. Okay, so we use them for external wind cold, lung wind cold with coughing, sore throat. So this is like Li4, lung 7, triple heater 5, GV14. Okay. The same oils can be used topically as well with wind, damp, cold obstruction as well. And then moving on, number 2, they warm the lung, they help expel phlegm, they diffuse lung qi and relieve cough. Okay, So they treat lung phlegm cold, like lung 7, lung 5, lung 1, P6, CV17, etc. Okay, and as I mentioned earlier, all of them are powerful qi tonics. They not only tonify the qi, but also help raise the body's clear yang qi to the brain, to the head, which is, so in other words, they strengthen the shen. Okay, they strengthen the shen, and thereby, so they're useful for not only immune weakness, lack of immune integrity, or infections, early stage infections, but also low energy, fatigue, shallow breathing, etc. Okay, so in that sense, these oils can work like acupuncture points: stomach 36, spleen 3, CV6, and GV20 by way. Okay. Okay, so that's all. So that basically is that it covers the oils that stimulate immune functions directly. Now, what about the issue of boosting long-term immune potential? Okay, so this is the more long haul project. Okay, how do we do that? The oils we use are completely different. So what they are pungent woody oils that have a tropism or affinity for the kidney yang and the body's jing. So first of all, they're pungent woody. For example, black spruce oil. Okay, the two main ones that we use, at least that I use, for tonifying kidney yang and boosting long-term immune potential are black spruce and Scotch pine. Okay, and as far as boosting kidney yang and jing, they're pretty much interchangeable. Okay, so physiologically they work by boosting neuroendocrine functions. They work on the HPA axis, the hypothalamus pituitary adrenal axis, which governs long-term immune potential. Okay, so they boost immune functions by working on jing or jing essence or endocrine functions. Okay, so in that sense, they work like acupuncture points that do the same thing. For example, kidney 3, tai chi, spleen 6, stomach 36, CV4, governing vessel 4 or do 4, and bladder 23. Okay, so obviously you can tell that here we're dealing with an internal weakness, an internal deficiency. We're boosting the kidney yang and the jing in order to, over time, slowly but gradually boost long-term immune potential. In other words, so that you don't get sick at the drop of a hat, at the drop of a virus, right?
Peter, can I ask you, I'm getting some requests for people, if you can repeat the acupuncture points and just say them really slowly because they're trying to take notes.
Okay, certainly, yeah. Thanks. So the points that I use for boosting immune functions, but by working on endocrine functions. So in other words, all these points work on the body's jing in one way or another, right? Kidney 3, my favorite point of all, probably. You know, you cannot overuse kidney 3, I think. You know, it's a strongly hormonally acting point, especially in women, okay? But in men too. Spleen 6 is hormonally or endocrine, has endocrine activity. Spleen 6, stomach 36, conception vessel 4 or REN 4, GV 4 or DO 4, and bladder 23, of course, right? Okay, so all of it, all of these oils also treat chronic lung weakness. They should be used for these oils, as well as some of these points, of course, should be used for any chronic respiratory condition. Okay, so for example, lung and kidney yang deficiency. So in this pattern, these oils will diffuse lung qi, help descend lung qi, and relieve wheezing. Okay. Another function of these oils, in other words, the black spruce and the Scotch pine, is to resolve and expel phlegm and relieve pain and cough. Okay. So in this case, they work in a similar way to the immune stimulating or antiviral oils like cajeput and niuli. Okay. So they resolve and expel phlegm, relieve pain and cough, chest pain and cough. And they can also be used to warm and open the channels and dispel wind damp B. Okay. Any questions about these particular oils or points or how to use them?
We didn't get any questions so far about those,
okay.
But we do have a question about eucalyptus from the last group. Is the eucalyptus growing in California narrow leaf eucalyptus? And also, how do the energetics differ between Eucalyptus radiata and Eucalyptus globulus?
Okay. They are somewhat different. They both happen to be antiviral, but so here's some differences between the. Okay, I'm hearing two questions. I'll answer the first one.
Correct.
No, neither of those. No, the blue gum, the globulus, does grow in California. The narrow leaf, I've never seen a narrow leaf or radiata eucalyptus anywhere in California. Okay, I've seen the lemon eucalyptus in LA. It's all over Southern California, but not around, but not the narrow leaf. Okay, so the difference between the narrow leaf and the blue gum is as follows. The narrow leaf, the radiata, is a stronger antiviral than the blue gum, globulus. Okay, so it's much more appropriate nowadays, the narrow leaf. In terms of pattern treatment, the narrow leaf is really for early and middle stage of external wind cold and lung wind cold. Okay, early and middle stages, when the infection is in the sinuses, the throat, and just beginning to descend into the lungs. Okay, which is also the early stage of any virus, right? Okay. Whereas the blue gum eucalyptus, globulus, is more effective. First of all, it's a better antibacterial. It's a stronger antibacterial than the narrow leaf, but it's less antiviral, and it has a stronger affinity for the deeper bronchi, in other words, for the lungs, rather than for the upper respiratory system. Okay, so the blue gum eucalyptus should be used when the infection has actually moved into the lungs, causing phlegm, cough, expectoration, chest pain, possibly wheezing, etc. That's when the blue gum really works really well.
Okay, and we do have a couple of other questions now.
Okay.
Would we use these oils, the ones that you were most recently talking about, black spruce and Scotch pine, in combination or individually?
You mean, can you use the black spruce and Scotch pine together? Of course, yes.
Yeah, do you prefer them together or indivially? And
doesn't matter. Doesn't matter. They will, I mean, like two herbs, they will reinforce each other, I think. Can't go wrong there.
And the next question is, how frequently, if you're applying black spruce on the points that you mentioned, how frequently would you suggest that you apply the oils to those points?
Okay, I would. It depends how great the weakness or deficiency is, but every day would be fine. Every other day is fine. I mean, I think every 2 or 3 days would be an average treatment. Of course, if you're going to see a practitioner to get it done yourself, then it tends to be once weekly. But there's nothing wrong with doing it several times a week. Yeah, and I do for also. I'll add to that for boosting the kidney yang and jing, to boost long-term immune potential. I would definitely use the foot arch treatment in addition to the points.
Okay. The next question is, can you talk about black spruce versus blue spruce or other types of pine?
Again, that would, unfortunately, I would love to, but unfortunately, that would derail us into a whole other discussion. We don't have time. No.
And somebody says, Peter, you mentioned in a recent article using Palmarosa for immune strength. Can you speak about that, or will you be speaking about that anyway later?
Yep. I'm actually coming to that. Yeah.
Okay, so why don't we do that, and we'll save the rest of the questions.
Okay. So long-term, so I want to look at the bigger picture for boosting long-term immune potential. Okay. So it's not just about essential oils. So what are the three main factors on which immune potential, immune activity actually depends? I think it's three things. Number one, emotional health and emotional balance. Okay. Number two, Chinese medicine spleen functions or the intestinal microflora. Okay, the health of the intestinal microflora or microbiota. Okay, which is actually a discrete organ, most of which is in the large intestine. It actually weighs 2.5 pounds in the average adult, and it actually carries out many, if not most, of Chinese medicine spleen functions. Okay, so all of those, most of spleen functions in Chinese medicine are carried out by the intestinal microflora. So that's number two. The third factor that determines long-term immune strength is the health of the brain and the neuroendocrine system as a whole, okay, which corresponds to Jing and Shen in Chinese medicine. So the Jing Shen is housed in the brain as well as in the heart, and it corresponds to neuroendocrine functions as a whole. All the body's, the dance of the peptide throughout the body is Jing Shen. Okay, it's neuroendocrine, it's hormones, neurotransmitters, etc. Anything that's a peptide in the body. Okay. So talking of which, so I just want to end up with some basic, just simple ideas. Obviously, we don't have time to go into each of these three big factors in any depth, but worry and anxiety is pretty rampant nowadays, and that we need to, so obviously that causes a lot of emotional distress. It causes a lot of issues, obviously. So the basic treatment that I developed many years ago is called using bergamot oil on ear shen men. Okay, so what you do, it's a very simple technique that I've been teaching for many years. Actually put a drop of bergamot oil on one finger, drop it, wet 2 fingers with it, and apply it onto the ear point shen men. I've forgotten the exact technical anatomical description, but it's near, perhaps Cynthia, you can voice in at this point. I don't know. Anyway, and hold it there for 1 minute, at least 1 minute. Okay, and then drop your shoulders, breathe. You know, take a moment just for yourself. You can also smell it. Once you have it in, after you've done that, you can also smell it. Okay, so what does this treatment do? What it does is it basically treats, harmonizes the Shen. It balances or harmonizes the Shen, the spirit, and allows the mind to be more focused. Okay, so it clarifies the mind and also the heart, actually, the Shen in the heart as well. It's great for studying, for being present, for focusing on something. So that's one thing. The other thing that this treatment does, it's a really good mood balancer. Okay, and Lord knows we all need that nowadays, right? Whether you're feeling more down or feeling more agitated, anxious, it tends to even out your current mood. Okay, which is again the marriage of the point shen man with bergamot essential oil. Okay, now specifically for worry and anxiety, you might also want to try lemony sweet oils like mandarin, sweet orange, nerulina. Okay, these are my three favorites, which work like bergamot oil, except a bit more calming to the spirit or the shen. Okay, and so you can smell those. You can also put them. You can put them in a nebulizer. Right, you can put them on a nebulizer. You can any of the ways that we discussed of making the inhalation methods to make it available to the sense of smell. You can use them on points as well, points that calm the shen. Okay, yin tong, pericardium 6, etc., etc. Right. So those are called lemony sweet oils. Once again, they're mandarin, sweet orange, and nerulina. Okay. Another oil category I like using a lot, we call the sweet green oils such as lavender, lavandin, blue tansy, and sambac jasmine. Okay, and these sweet green oils also have a calming effect on the spirit or the shen. Okay, so and they're actually a bit more calming than the lemony sweet, the previous group. Okay, once again, those oils are lavender, lavandin, blue tansy, and sambac jasmine. Okay, the blue tansy, be sure if you use the blue tansy or the sambac jasmine, be sure that they're diluted in a vegetable carrier oil, because otherwise they're too strong and they may not smell nice at all. Okay.
Peter, can I interrupt for one question? People wanted to know green mandarin or red.
Right. Either one. Both work really well. They both work. The red mandarin is more, a little bit gentler, a little bit more supportive. It tends more to the heart and pericardium channels, whereas the green mandarin is Qingpi. It's the difference between Chenpi and Qingpi in herbal medicine, right? Qingpi is the green unripe mandarin peel, so which acts more on the liver channel and actually heart and liver, and is better for pain. Okay. Hope that helps.
Great,
okay.
Thanks.
Moving on. So there's a few ideas for worry, anxiety, and just for mood balancing and calming and focusing your spirit or shen in general. Okay. The next issue is the Chinese medicine spleen or intestinal microflora. So it's interesting that the Western concept of intestinal dysbiosis, which means an unhealthy mix of the microflora, actually corresponds, I think, to what Chinese medicine calls turbid damp in the spleen, okay, or damp turbidity in the spleen. The symptoms are exactly the same. I would say that the key symptom would be irregular bowel movement, in other words, alternating loose and hard stool. Okay, so a few years ago, I experimented with Palmarosa oil, Palmarosa Cymbopogon martini, and I using it both either topically applying a drop or two topically in the abdominal area, for example, stomach 25, CV6, even CV or Ren 12 as well, Zhongwan. What that does, or making a gel cap with Palmarosa oil, actually has a prebiotic effect. So it acts as a righteous prebiotic, like many of the others, like fermented foods, like fiber, like food fibers, etc., etc. Okay. So that's for working on for cleaning up the intestinal microflora. In other words, the spleen damp turbidity. Okay. The last pillar of long-term immune functioning is, of course, hormonal balance. Okay, so hormonal imbalances are any kind of hormonal or endocrine imbalance will tend to make immune functions less efficient. Okay, so for hormonal imbalances, we saw points. I mentioned points like kidney 3, CV4, and spleen 6. And the top 3 oils, I think that can help in general, without going into a whole other discussion, would be geranium essential oil, also known as rose geranium, rose essential oil, which you might want to dilute because it's very strong and very expensive as well. Okay, and it works fine diluted in a carrier oil or lotion. Okay, so it's geranium, rose, and the third one is clary sage. Okay, clary sage in women is another wonderful hormonal balancer. And again, they can be used on acupuncture points like kidney 3, CV4, spleen 6, as well as other points on the body, appropriate points on the body, as well as by foot arch delivery, application on the arch of the foot. Okay. That's basically all the material I'd like to cover, and as you know, I'm open to questions at this point.
Peter, one question is, somebody wanted to know what was the spelling of the oil that you talked about for dysbiosis in the intestines?
Oh, Palmarosa. Palma, as in palm. So Palmarosa. Palmarosa, literally rosy palm.
Okay. And the next question is, how many drops in a capsule?
Okay, gel cap, we usually put 3 or 4 drops, not as a general rule, not more than 4 drops per single gel cap. 4 drops, and then so what I do is I get an empty gel cap, I drop in with a dropper. I drop in 1, 2, 3, 4 drops, okay? Then I top it up with olive oil, okay? Or any other liquid oil, close the cap, and then drink that with some warm liquid, okay? And that the point of a gel cap is to make sure that it goes into down into the small intestine, which is where you want this oil to go, or whatever oil you're using, okay?
And Peter, they're asking.
Yeah, and you do it. So you do it, and you do that twice a day. Sorry, you do that twice a day. So 2 gel caps of 3 or 4 drops each. So you're basically ingesting 6 to 8 drops of the oil in a single day. If you do more than that, you're getting into more technical and medical territory, which is another whole other discussion.
Speaking of that territory, somebody wants to know, can you tell them the Latin name for Palmarosa?
Yeah, Cymbopogon, CYM, B, starts with CYMB, Cymbopogon martinii, as in Martin, like the name Martin.
Okay. And this is a more general question about essential oils, but if we have time, how long do essential oils last for?
Okay. Well, we're incredibly lucky because they can last many, many years under good storage conditions. And that's the big if. The big prerequisite is that the oils be kept airtight in a bottle. Always, you never leave them lying around open, okay? You always put the cap back on. And a good oil at room temperature should last a minimum of 10 years, okay? And some oils have lasted 50 years and more with relatively little oxygen in the bottle. It's a process of oxidation that is the #1 factor in inhibiting essential oil quality. It's all about oxidation.
Okay. And then somebody wants to know, I've heard from an herbalist that using steam inhalation with essential oils can damage the nasal hairs. Is this true?
Damage the nasal hairs? I've never heard that. Damage the no, I don't know. No comment. All I can say is that it seems highly unlikely. That's my official statement.
People are asking about if something's ingested, better on empty stomach or with food in the stomach.
For doing what treatment?
If they're going to ingest essential oils.
Oh, again, both can be done. If a gel cap is okay, let me backtrack. If you're going to ingest an essential oil, please make a gel cap. Please, please, please. Don't start drinking drops of oil floating on water. No good. You're wasting your time and you're wasting your money. Okay, it's got to be, if you're using the oral pathway of delivery, you have to get it into a gel cap. Oh, I forgot one other nifty treatment that I want to add to that, and I'm going to add that now actually, and that is dropping one drop. This is very pertinent because you can drop one drop of essential oil actually directly onto the tongue. It's called lingual delivery. Okay, what you have to do is to get just one drop on a dropper. Good luck, by the way, it's not easy. One drop, and then plop it onto the surface, on the anterior surface of the tongue, and hold it there as long as you can. What that will do, that is actually a French medical treatment for disinfecting the nasal passages and the sinuses, okay? If you put it under the tongue, it won't have the same effect. It's got to be on top of the tongue, okay? Again, we can use this. Sorry. Again, we can use the same oils I mentioned in the beginning. The immune-stimulating antiviral oils: cajeput, sauro, ravinsara, etc. Okay.
So they want to know if they take the gel caps better on an empty or a full stomach.
Right. Okay. If it's taken on a full stomach or with food, then it has a milder effect because it gets a lot of it gets diluted with the food. If it's taken outside of food, i.e. in between meals, then you get a stronger effect, stronger, more treatment-like action. Yeah.
So the blend of clary sage, geranium rose, and geranium rose and clary sage, does that boost estrogen or progesterone?
Okay, that is okay. Those three those are individual oils. That's not a blend. I mean, of course, you can make a blend out of those, but then just use them singly. At this point, use them singly and see how they work. You know, try one, try geranium, try clary sage, or try rose. But they each work on, as far as hormonal, they all tend to balance hormonal functions, but they're more suitable for different patterns as well. So they will treat for geranium is basically excellent for the kind of person who's damp, spleen damp all over, right? Clary sage is much more useful for the person who's essentially tense and suffering from constrained qi, with the qi stagnation, qi constraint of the liver and heart, and so on and so on. Okay, even though they have the same fundamental function of balancing hormones.
I think I'm going to take a couple more because these are mostly getting into sort of more general essential oil questions. I know people have lots and lots of questions, and you have lots of classes you can teach.
Yeah.
So we aren't going to be able to answer everybody's questions about essential oils in general, but we will try to answer the ones about the immune system.
Okay.
But we do have a couple more. One was, what is the maximum drops of essential oils we can use in a gel tab?
Again, that's a highly theoretical question. That question should be turned around into a clinical practice question, again, which we don't have time to answer. But even in the most acute infections, for example, if a French MD or European naturopathic doctor was treating an acute infection, and even if they're using prescribing several gel caps a day, then they would never use more than maybe 6 drops per gel cap, but that's specifics under the specific circumstance for an acute infection of some kind, with multiple gel caps throughout the day. Okay.
Okay, and one last question is, what is the maximum, oh, sorry, I have heard that using lavender can cause an opposite effect sometimes, increased anxiety or jitters in some people. Is that true?
I would, again, that question is highly theoretical, and it opens up a whole question about how to use lavender oil in practice. And my simple answer would be no, but my considered answer would be, well, it all depends. But in general, no. If that happens, that means the person prescribing the lavender doesn't know what they're doing, as far as I'm concerned. That should not happen.
So it means that the lavender is not being prescribed in the correct situation, is what you're saying?
Yes, or the lavender is poor quality, or whatever. Some other factors interfering. Okay.
Well, we know people have lots more questions all about essential oils and all about different things about essential oils. Clearly, Peter has a tremendous amount of knowledge, and hopefully we'll be teaching more classes about all the different things about essential oils. Luckily tonight, he's given us really, really huge amount of information about essential oils for immunity. You will be able to hear him at Pacific Symposium, both live, where you can meet him and actually smell the oils, and that will be streamed as well. We will have a recording of this webinar, so you'll be able to go back through it, and we will put out some notes as well if anybody missed some of the oils or some of the points. But I just want to say a really huge thank you to Peter for a tremendous amount of information in a short period of time. Peter, if you could see all the comments, thank you, thank you, thank you, thank you, thank you. Everybody's thrilled with all this information.
Thank you, thank you. Thank you, Cynthia. Thank you, Jack. Thank you for facilitating this. I hope we can do lots more. Definitely.
Great. Thanks and good night, everybody.
Thank you for joining. Good night. Good night.